Hi, good morning, everyone. I am Dr. Rohan Vitanage. I am working as a senior lecturer uh, in the Department of Mathematical Sciences, YM University of Sri Lanka. So today I am going to discuss about some optimal control theory problem based on my one of research done in this year. So this is my topic. So optimal immunotherapy interactions in oncolytic viral therapy and adaptive cell transfer for cancer treatment with saturation effects. So these are the outlines of my talk. So first, I suppose to discuss about interaction. Then I suppose to give some idea about the mathematical model of interaction between tumor and immune system with oncolytic viruses. Then optimal control problem and existence of optimal control pair, the adjoint system and characterization of control pair, then numerical investigations, then monotherapy of oncolytic viruses, then monotherapy of adaptive cell transfer. At the end, I suppose to discuss about the combination of oncolytic viral therapy and adaptive cell transfer, then the summary and conclusion. So let's look at the introduction about the cancer treatments. So traditional treatments of malignant tumors consist of surgery. In the past history, you know that thousands so many years ago, when the treating for cancer, people use surgeries. That is the most primary level of treatments. Then chemotherapy and radiation therapy also played some crucial part there. So in recent years, immunotherapy has emerged as a promising approach to fighting cancer. So immunotherapy is a very important weapon to fight with cancers in previous history, in last previous years. So immunotherapy uses certain parts of person's immune system to attack cancer cells. As an example, if we consider about adaptive cell transfer therapy, when we consider about patient's body, some cells are taken, then they have developed in a laboratory level, then millions and billions of copies are made in the laboratory, and at the end, that improved cells are injected to the patient's body. That is a normal process of this adaptive cell transfer. There are monoclonal antibodies, cancer vaccines, immune checkpoint inhibitors, and such kind of treatment methods are used there. So in our research, we work adaptive cell transfer. This is done by selecting and expanding patient's own tumor, specific T cells in the body, and they are taking it outside. Then they are developed, and again, they have injected to the patient's body to fight with cancer. This is the normal process of immunotherapy of adaptive cell transfer treatment. So now let's pay our attention for the oncolytic viral therapy. So in this diagram, you can see that this green color represent oncolytic viruses. Then in this diagram, this orange color represent the tumor cells and blue color represent normal cells. So the specialty of this oncolytic virus is they can distinguish what are the harmful tumor cells. Then they have inflected to these malignant tumor cells. Then they make billions of copies on there. Then with the help of the T cells and NK cells and the environment of our own immune system, with the support of this oncolytic virus, they can attack for the cancer cells in some high temperature level. So this is the normal process how oncolytic viruses fight with cancers. Here the macrographs and T lymphocytes are played some crucial role. For the cytons can recruit other immune cells to human site and active to destroy cancer cells. So here macrographs and T lymphocytes are some specific kind of white blood cells. So oncolytic viruses infect cancer cells and kill them without harming healthy cells. So this is a positive fact, and this is very important. The most successful example of oncolytic virus is given by Talimogene. So this is now recently clinically testing. So for this, mainly we use measles, and simplex viruses. So someone can ask, what is the oncolytic virus? The basic idea of the oncolytic virus is, as an example, if you get some cough or if you get some fever, there is some virus in your body. That virus is some specific kind of oncolytic virus. So in this research, mainly a lot of thousands of researchers use this harmful uh, oncolytic virus to fight with cancer. So this is a new innovation in modern scientific, especially biological field. So due to these impressive results obtained from Treg, a variety of oncolytic viruses has been tested in clinical trials over the last few years, including adenoviruses, herpes simplex viruses, measles viruses, and Newcastle disease viruses. However, normal cells recognize the innovation of viruses as foreign pathogens and mount a strong antiviral response to eventually kill viruses. So now let's pay attention for the model. Here the model contains 4 state variables. Here the X is the susceptible tumor cell population, and Y is the infected tumor cell population. V is the compartment of free viral particles, and Z is the immune cell population. So the susceptible tumor population grows logistically with intrinsic growth rate R and the carrying capacity 1 over B. So the viral particles infect on a certain proportion of tumor, and the infection process is modeled by Michelius-Menten term. So what is this Michelius-Menten term? In the biochemistry, we know that when there is some chemical reaction is going, it is increasing gradually, then it can come to a constant level. So this is mathematically represented by this Michelius-Menten term. So the viral cells attack into the susceptible tumor cell population to destroy the susceptible tumor cell. So this process is going according to the Michelius-Menten process. And the killing of tumor cells by immune cells also very important in this treatment therapy, because when we discuss about that adaptive cell transfer, directly it is connected with the immune therapy. So this immune therapy is working according to the mass action law. So in chemistry, we have learned that in a chemical reaction, that reactant speed is proportional to the existing reactants in that body. So if you think we are working with just susceptible tumor cells, and on the other hand, that immune cells, this rate is proportional to that existing amounts of immune cells and susceptible tumor cell populations. Then another assumption is that immune cells also kill viruses and according to the mass action law. The immune cells are supplied at a constant rate S, because from the outside, we are giving some immune cells to the body to fight with cancers. When oncolytic viruses infect and destroy cancer cells, specific antigens are released in the tumor microenvironment, allowing to immune cells to be activated. And this process is also modeled by Michelius-Menten mechanism. Immune cells can now be stimulated to grow at the maximum rate BE. So the specialty in our research is, in some hand, these tumor cells suppose help to apply to these immune cells in the body. And on the other hand, these tumor cells may become resistant for the immune cells. So it has some positive and negative effects in both sides. The Michelius-Menten form is adapted for both immune activation and exhaustion with half saturation constant Ke and Kd respectively. So this is the schematic diagram of the model. So you can see that this blunt arrow represents the killing of this given specific kind of cells, and on the other hand, this normal arrow, blue color arrow represent activation of specific kind of cells. So as an example, if you see that the interaction between susceptible tumor cells and immune cells, this blue arrow represented by BE rate. The susceptible tumor cells can activate immune cells, and on the other hand, the susceptible tumor cells can make some resistance for the flow of the immune cells by the rate of BE. So in this model, you can see that So this is our model. X represents the susceptible tumor cell population, Y is infected tumor cell population, and V is the viral cell population, and C is the immune cell population. So these are the parameter values here. So R is the intrinsic growth rate of susceptible tumor cells, and B is the inverse carrying capacity of tumor cells. Beta is the maximum infection rate of viral cells. K is the rate at which uninfected tumor cells are destroyed by immunity. A is the killing rate of viral cells by tumor cells. C is the rate the infected tumor cells are killed by immunity by viral burst rate. Q is the viral burst rate. Delta is the destroy rate of viral cells. Gamma is the destroying rate of viral cells by immune cells. B is the maximum stimulating rate of immune cells by tumor cells. D is the maximum inhibition rate of immune cells by susceptible tumor cells. So here BE is the stimulating rate of immune cells by tumor cells, and DE is the inhibition rate of immune cells by tumor cells. And K is the half saturation constant, and KD also another half saturation constant. P is the maximum infection rate of viral cells infected to immune cells. H is the half saturation constant in infection to immune cells. S is the supply rate of immune cells, and D is the rate of immune cells. So here all the parameters are positive, and the solutions of that given previous equation system remain non-negative, and they are bounded on 0 to infinity. Then let's look at the optimal control problem. So the research problem in here is our goal is to minimize both tumor size and the cost of implementing immunotherapy over the treatment period. So indirectly, we need to minimize the tumor cell population from a minimum cost. That is our final purpose. So this is industrial also very important, because we know that when we are constructing some medicine to treat for some disease, the cost must be minimum, and from that minimum cost, we must be able to destroy as possible much as cancer cells. So here S1 and S2 represent the strength of oncolytic viral therapy and adaptive cell transfer immunotherapy. So S1 means the amount that we are given viral cells, that is measured by PFU per day. It means plant per units per day, and S2 is measured by cells per day, because these are immune cells from the adaptive cell transfer therapy we are given to the body. So here U1 and U2 are controls. So it means U1 has two possibilities. It can be 1 or 0, and U2 also has two possibilities, 1 or 0. So U1 is 1 means we are given the treatment, and U1 is 0 means we are not given the treatment. In the future diagrams, you can see about that, and we haven't any dimensions. So this is the state equation. So if you look at this equation system cautiously, you can see for the V prime, we have added this one U1. It means there we are giving the viral therapy from the rate of S1, and the control variable is U1. And on the other hand, from the Z prime, we are giving that immunotherapy, that is represented by S2 U2. Here the S2 is the amount that we are given per day, and U2 is the control variable. Then next you can see the objective functional. So this is the thing we need to minimize. This has constructed according to the linear quadratic controller modeling. So you can see that here XT is the susceptible tumor cell population. So we need to minimize the susceptible tumor population with the minimum cost. So these are the existence of optimal control pair. To exist this optimal control pair, it must satisfy these conditions. So the first condition is that is the set of all initial conditions with the control pair for which the state equation being satisfied is non-linear. It is obvious. And you must be close and convex set. The right-hand side of each state equation is continuous, bounded above by the sum of control and the state, and can be written as a linear function of U and U2, which coefficients depending on time and the state. The integrand of J is 10x in U1 is bounded below by negative K2 plus K1 times U1 U to the power neta, with K is positive and neta is greater than 1. Then we are using the Pontryagin maximum principle. Here, first we construct the Hamiltonian of this optimal control problem as below. So it has four adjoint variables, lambda1, lambda2, lambda3, and lambda4. So this is the Hamiltonian. So it is somewhat some weird term because it has too many terms there. Because it is a four-dimensional equation, differential equation. So these are adjoint variables. You can see that lambda1 prime is equal to negative dou by h over dou by x, and lambda2 prime is equal to negative dou by h over dou by y, and lambda3 prime is equal to negative dou by h over dou by b, and lambda4 prime is equal to negative dou by h over dou by z. So we have obtained a control pair by differentiating this Hamiltonian with respect to U1 and U2. So now already we have found the adjoint variables and adjoint system there. And also we have obtained the control pair is here. And we have proven that control pair is existing. So the adjoint system, you can see it has four differential equations there. Lambda1 prime, lambda2 prime, lambda3 prime, and lambda4 prime. These are the parameter values we are using in our research. Mainly these are taken from some previous research papers and R is taken as estimation by using the BXP3 cell line. This is some carcinoma cell line used in penetrative cancer. So then we have done some numerical investigations here. So basically we use MATLAB programming by using Wangekutta forward and backward method. So we vary the parameter values beta, gamma, D, E, and K, unless otherwise it's stated C1 is 10 and C2 is 10. Okay, let's see about our first diagram. So in here, the diagram, you can see that this red dotted line represents the treatment without therapy, and blue line represents the treatment with therapy, and blue star represents the control. So if you look at diagram A cautiously, you can see that at the first day, control value is 1. So it means we are giving the treatment at the first day. The same day, the tumor population becomes 0. You can see that. So it is very successful. So if you look at the beta is equal to 0.6 there, and S1 is equal to 10 to the power 8. And the next beta is 0.6, and we reduce S1 to 10 to the power 5. So you can see that we have to give the treatment for 3 days. So it implies that when we are decreasing the amount we are given to the body as oncolytic virus, we have to give the treatment for more days. And on the other hand, let's say about the C diagram, there we have reduced the beta to 0.2, but we are given a high rate. There also we can see that we have to do the treatment for 2 days. But on the other hand, in the diagram D, you can see that we are given the beta as 0.2. What is this beta? Beta means the infection rate of viral cells to this susceptible tumor population. So there you can see that it is in a very low rate in diagram D. But in that case, we have to do the treatment for 70 days. So it implies that if we need to minimize this tumor cell population, we need a very strong viral infection rate. So then let's look at the monotherapy as adaptive cell transfer. Here, the specialty is only considering about the adaptive cell transfer. There is no any oncolytic virus here. So if you look at this, mainly we are changing the parameter K. The parameter K is related with the destroying rate of this susceptible tumor cells by immune cells. Now the immune cells are in the world. Okay, now let's look at their performance. So here you can see that gradually I am increasing the performances of these immune cells. So you can see that in A, I am using 5 times 10 to the power negative 4. In B also, I'm using 5 times 10 to the power negative 4. Yes, and D is the negative 4. And yes, the specialties I have reduce DE. You can see that DE means that we can say that uh, harming, I mean, the negative effect done by this tumor cells to this immune cell population. So it is the resistance of the tumor cells making for the immune cells. So we can see that when we are decreasing this resistance by tumor cells to immune cells, our therapy becomes success little by little. So if you look at the diagram A, we can see that we can stabilize the treatment, I mean tumor level, but in become diagram B, we can stabilize to a lower level. So it is more successful because we are increase. So yes, we are decreasing B, and on the other hand, when we are taking it to the 600, it is again has going some stabilized level, but at the end you see we are making very small level. D is equal to 300. There we can completely remove the cancer there. So we can see that when we are decreasing that diffusion rate of this tumor cells with these immune cells, we can reduce this tumor very successfully. So when we decrease the immune exhaustion rate, it is obvious that the cancer can reduce easily. The increment of the tumor killing rate can help to reduce the tumor level, but how to give the therapy continuously. Then let's look at the combined therapy here. So here this green color represents the immune cell adaptive cell transfer therapy, and the blue color control diagram represents the immune oncolytic viral therapy. You can see that at the beginning of here, we are using S1 is 10 to the 6 times 10 to the power 6, and S2 is 10 to the power 3. So here we are using some weak S2 rate and with a powerful S1 rate. Then gradually we are increasing the rate of S2. So it means gradually we are increasing the rate of this immune effect. It means adaptive cell transfer. There we can see that little by little this tumor population we can reduce. So here the most crucial part is acted by this adaptive cell transfer therapy than oncolytic viral therapy. So here we observe that when we increase the dosage, it is easier to reduce the tumor size, but we have to do the treatments continuously. So if you look at these diagrams, you can see that in the cases of C and D, we have to give both treatments continuously. So this is a big disadvantage there, because we have to use a lot of cost there, we have to use a lot of time, patients and doctors' time there. So it seems that as a combination, we are giving a therapy, it is not successful too much. Then let's look at another procedure. So here also we are considering how this K parameter is changing. This K represent that killing rate of these susceptible tumor cells by immune cell population. So here, gradually we are increasing the performance of K. You can see that in A it is 3, and D it is 5, then it is 6 and 7. So in this stage, we change the killing rate of tumor cells. It is clear that when you increase the killing rate of tumor cells, it becomes easier to reduce the tumor, but we have to give both therapies continuously. That is also the disadvantage there. So this is the summary and conclusion here. Although the immune cells can eliminate a virus from oncolytic viral therapy, the two therapies do not strategize. It means giving the therapies individually is better. Otherwise, if we giving it as combined therapy, it is not successful too much, and we can see that we have to use a lot of cost and a lot of time to reduce this cancer. In oncolytic viral monotherapy, the killing rate of susceptible tumor cells by immune cells is very important. And in adaptive cell transfer therapy means exhaustion rate is crucial, reducing the decrease of tumor level. So here, adaptive cell transfer plays a crucial role other than this oncolytic viral therapy. Okay, now these are my references, and thank you.